Hey everybody, Monika Buerger here, the founder of the Academy of Neurodevelopmental Practices. So I want to bring to you today some hopefully thought-provoking information when it comes around autism. So in April of 2025, the CDC released its numbers as far as kiddos being anticipated to be diagnosed with autism by their 8th birthday. And those numbers released in 2025 were based off of 2022, a 2022 study. And those numbers were 1 in 31. So by the 8th birthday, 1 in 31 children in the United States will receive, or is anticipated to receive, a diagnosis of autism. Compare that to numbers that were released in 2022 based off of 2020 numbers, and that reflected 1 in 36 kiddos by their 8th birthday would have a diagnosis of autism. So I have a saying, I've been hammered since those numbers came out. I've been getting inquiries from around the world. What is going on? What do we need to know? In the traditional thinking paradigm, in the medical paradigm, it's the reason those numbers are going up is because of better awareness, better diagnosis, et cetera, et cetera. But people are reaching out to me like, what do we need to know? Why is this happening? And I have a saying that the roots of any challenge really presenting in front of you at a given time often lie in the past. So we really need to know how to do a deep dive history into preconception, prenatal, and the first year postnatally in particular. In fact, the developmental critical window of development is fetal development in the first 2 years postnatally. And this is incredibly important that you understand how to help manage these time periods to help decrease the stress load. And that's how we're going to change the tide on these numbers. Because if we lay a stronger, healthier foundation before that little fiddle fart presents to us with challenges, that's where we're going to be able to turn the tide into the numbers. So in our Foundations in Neurodevelopment course, we hammer that. We teach you and guide you through step by step of things to think: preconception, prenatal, postnatal. How can we intervene before the problem becomes big? That is key. One of the areas that has been so vastly studied for over a decade is MIA, Maternal Immune Activation Syndrome. Moms have a chronic inflammatory load. Their immune system's overactive and is producing this chronic inflammatory load. And that inflammatory load, it doesn't have to present with overt symptoms. That's what you need to know. It could be moms just under a lot of stress, which we need to define stress in the preconception terms and the prenatal period. Stress is chemical, physical, emotional, mental. Any stressors can set that HPA axis, that stress axis, into overdrive and result in a chronic inflammatory load. And this is what is the crux, really, of neurodevelopmental challenges. So one, you need to be able to identify, you need to have the right history questions to ask, be able to identify those stressors and how to decrease that load in order to foster optimum neurological development in utero. That is critical right there. So MIA, Maternal Immune Activation Syndrome, has been researched for a couple decades with regard to, as underlying roots to setting the stage for a child later on getting diagnosed with autism. So we need to support mom and dad, preconception, prenatal, and postnatally. We need to advocate breastfeeding. We need to advocate, I talk about prenatal, postnatal, and polyvagal because the vagal tone is everywhere these days. How do we help caregivers foster optimal vagal tone and vagal nervous system development, especially in the first 6 months of life? And that's another thing we go through in our Foundations in Neurodevelopment course. I want to leave you with the thought that if we really want to turn the tide for healthier generations, we need to understand the root cause before we're dealing with a diagnosis or a struggle in our offices. Most diseases, whether it be from neurodevelopment to neurodegeneration, begin 20 years before the symptoms show up. Now, you go, how can it be in an 8-year-old 20 years before? They're only 8, do the math. Really, mom and dad's stress load, which we inherit actually from our ancestors, it is a pull down effect. And the way mom and dad handle different stresses in their life will set the HPA axis of the little fiddle fart, which sets that potential inflammatory cascade. And that's what's detrimental during brain development. So these are things we need to know and understand. So back to the 8-year-old. How can that have started 20 years prior? It's because mom and dad's stress load has altered the neurobiology of their health, which is going to set the tone for the neurobiology of the offspring. So we want to start preconception, ultimately if you can. If not, definitely during the prenatal period. If that's not possible, then postnatally as soon as you can see them in your offices. So if you want to learn more, if you really want to hone in your skills, if you want to up your game, this is the program for you. This program isn't for everybody. It's only those that want to be the best in the pediatric chiropractic world and to understand typical and atypical neurodevelopment, how to foster optimal neurodevelopment. That is key, is crucial for right now, so we can help change the tide and change these numbers so that we don't see that come to fruition, that 1 in 31 kiddos by the time they're 8 has a diagnosis of autism. So you want to learn more, scroll down, click the button, join our group, and let me help you become the go-to pediatric chiropractor in your community so we can turn the tide on these neurodevelopmental disorders.